A slow-moving healthcare crisis has left millions of Canadians without a doctor. There are a number of reasons for the problem, including the years-long process to get foreign credentials recognized here. But there are also people working on solutions. As part of our Critical Care series, CTV's Genevieve Beauchemin gives those plans a closer look.
Right, so this is not good and there's no pulse.
Urgently needed, these first-year medical students are training to be family doctors.
There we go, okay.
They're part of an innovative program taking aim at the critical shortage of general practitioners. Canada is expected to be short 30,000 family doctors by 2028.
Primary care is the front door of the healthcare system. And so if you don't have a family doctor or nurse practitioner or team that you can see when you need to, all sorts of things fall apart.
Julie Christoph's son has been on Quebec's online waitlist for nearly 2 years.
Everyone is feeling overwhelmed, and we're not really quite sure how to deal with even small issues.
You can't wait a year and a half.
Jane Philpott, former federal health minister, is now the Dean of Health Sciences at Queen's University. She says in traditional programs, only 30% of medical school graduates choose family medicine as their pick for residency.
Some of it has to do with the remuneration. Some of it has to do with the conditions of work for family doctors. It is such a hard specialty. I'm a family doctor myself, so I know that it's tough. You have to actually know about everything.
So see how the chest is going up now?
But for this first-of-its-kind program in Canada, a partnership between Queen's and Lakeridge Health, 20 students committed to family medicine before admission.
We're changing the way that medical education is going to be delivered so that we make sure that we know that these students are going to become family physicians, and as soon as they're finished their program, they're going to be out there and helping to solve the problem.
The government has proposed other cures, including an immigration fast track for hundreds of healthcare workers, though recognizing credentials of foreign doctors can still be a years-long process.
In our current system, we have the haves and the have-nots.
Dr. Tara Kieran proposes to reimagine the ailing system. It would be based on guaranteed access to primary care to every single Canadian.
Your kids are automatically guaranteed access to the local public school. We need that kind of system in primary care.
Now, that care could be provided by a doctor, but also a nurse practitioner or other healthcare professionals in a team-based clinic.
You don't have to go around begging, calling, looking up on Google to try and find out where there's a school that's open. But we haven't done that for access to primary care.
Philpott suggests a new law governing health care.
Any country in the world, and there are many, especially in Europe, where people do have universal access to primary care, that's founded on federal legislation. And I would argue that's what we need here in Canada as well.
So you're actually going to kind of put that over the nose?
In the meantime, the university is aiming to recruit more students looking to be the future of cradle-to-grave practice. And experts say investing in primary care pays off with fewer chronic diseases and cancers down the road. Genevieve Beauchemin, CTV News, Montreal.